available, preferably under open content licensing models, and using that to improve the quality of the teaching and learning environment for our students. Now, in African contexts, that is really essential, because the simple reality is that faculties of colleges of health sciences are typically very seriously structurally underfunded for the work that they're trying to do. So if we come into an environment and start saying to people, we think it's really critical that you invest in producing better teaching and learning environments and making sure that students have access to better quality materials, which are not just textbooks, but also video content, computer-based multimedia, and so on, where we can create a richer learning environment. The management of those institutions and those faculties will turn around to us and say, but we don't even have the money to cover our recurrent costs of operating the institution. And so in that environment, the idea that groups of academics are going to sit on their own, develop their own programs and courses, and design their own teaching and learning materials from scratch simply doesn't make any economic sense. And so by bringing all of those things together, we believe that we start to construct a very powerful argument for why investing time and effort in producing materials under open licensing frameworks and harnessing the rich intellectual capital that is increasingly available in the OER space is such an important component of making sure that health programs are working effectively and producing high quality graduates for our health systems in Africa. It's really those underlying philosophical principles that have guided the work that Catherine spoke about, and that increasingly now guide our desire to build a health OER network that involves not only African faculties of medicine and colleges of health science, but increasingly also their counterparts from all over the world. Because what we're really trying to do, having demonstrated the potential and the value of investing in producing effective teaching and learning materials by adapting existing open content, we're trying now to build a network of participants who increasingly are working with each other rather than having to work through a kind of project structure of the kind that we had to put together in order to make the proof of concept projects that Catherine just described very briefly work successfully. So our objective in creating a health OER network is to try to connect people who, on the one hand, have the need to gain access to high quality teaching and learning materials, and as Catherine's just highlighted, that need is not necessarily always a need in Africa. Very often African faculties of medicine